I'm certain necessary in a lot of places, but I'm also certain this is one of those things that a lot of people are going, oh no, not again. We got away from this, and now you're telling me we have to go back. What do you think?
I have a lot of thoughts on this. I'm so glad you invited me on the show here. So this is going to provide a lot of emotional whiplash for people who took the time and effort to get vaccinated and appropriately have been told the truth, which is that once you have been vaccinated, your risk for getting COVID-19 is dramatically reduced. The vaccines continue to be stunningly effective against all of the variants, including the more transmissible Delta variants. That said, we are seeing breakthrough cases. We're seeing people who have been double vaccinated who are getting COVID-19. But if they do get sick, they're getting milder infections. The risk for a severe breakthrough infection where you are hospitalized or worse, die from COVID-19, according to the CDC's data from July 19, 2021, is less than 0.003%. Very, very, very minuscule risk of being severely sick from COVID after you've been vaccinated. So I am recommending that my high-risk patients who are not willing to take that tiny risk of getting sick from COVID-19 at all, to think about masking if they're indoors in a high-risk area, for example, in a state that is not well vaccinated, has low vaccination percentages. But in general, I don't think we should mandate masking when the vaccines are as effective as they are.
Hindsight is always 20/20 on something like this, but it occurs to me that maybe the people in my business bear some of the responsibility for this too. We sold vaccines as magic bullets, that this was going to take care of everything. Get a shot, we'll be fine. For the most part, that's true. The problem is not everyone has the shot, and not everyone gets universal protection from these things. It is still possible to have these breakthrough infections. You can still transmit the virus. You can still make people sick and potentially kill them as a result from all this. And maybe we didn't do a great job of passing that message along early on. And that's sort of where we are right now, isn't it?
Here's the main problem is not that the vaccines aren't wonderfully effective. They are. The problem is that we only have, we have 49% of Americans who are not vaccinated. When you are unvaccinated, those are the people who are right in the eye of the storm from Delta. Those are the people, remember, 99% of people who are dying from COVID-19 in the United States are unvaccinated. 97% of people who are hospitalized from COVID-19 are unvaccinated. So again, the problem isn't the vaccines and their stunning effectiveness.
Yes.
The problem is that people aren't taking the vaccine and they are then spreading it to other people.
If there is a silver lining here, and it's still kind of tarnished, it is that all of a sudden a lot of people who had before said, I'm not getting a shot, suddenly have seen the light on this thing. So, would you recommend, if you were making public health decisions, big picture here, we got really good at big vaccine clinics before. We got a lot of people vaccinated. Do we need to go back in that direction?
We need every single American to roll up their arm and get the vaccine. They are life-saving. They not only protect you from the severe consequences of COVID-19, they protect you from getting COVID-19 at all. Of course, they are not 100%. There are breakthrough cases, but they are rare. The vaccines also protect you and the people around you because you're less likely to transmit the virus to other people. The virus is catapulting along and running roughshod through the country because people are not vaccinated. It's very plain and simple.
It sounds like you've been proactive with your patients, but I'm wondering, in your practice, are you going to make some sort of not blanket statement, but say, hey, look, folks, here's where we are right now on all this, and this is what I'm thinking, and get out in front of the messaging here, I guess?
Well, I think I've been writing a COVID-19 newsletter since March 2020, trying to help give real-time, fact-based information guidance on how to manage your mental health and your decision-making every day in the pandemic, which is, of course, a huge challenge, even for physicians. So I've made it clear that I think the vaccines are extraordinarily safe. They are stunningly effective. They are the path forward.
Those are important words. Dr. Lucy McBride, always nice to talk to you. Thank you. I appreciate the plain speaking. And I hope the next time we talk that we'll be in a better space than we are right now. Again, many thanks.
I think we're getting there.
I think you're right. When we come back for you on this Tuesday afternoon, it is, well, how can I put this politely?